So vaginal yeast infection is due to an overgrowth of candida in the vagina. This leads to symptoms of itchiness, irritation, soreness, and discharge. The conventional treatment for yeast infections are antifungal drugs, either an oral medication or topical creams. The concern with this approach is that the oral medication can be very toxic to the liver, and neither approach really gets to the root cause of the yeast infection. The cause of yeast infections is due to an overgrowth of candida in the vagina. Some candida is normally present in the vagina, but only becomes a problem when there's a disruption in the normal flora, specifically the amount of the Lactobacillus acidophilus in the vagina. This can result from recent antibiotic use, the use of lubricants and spermicides, hormonal changes, birth control pills, a poor diet, or weakened immune system. So I diagnosed a yeast infection by getting a really good history on my patient, doing a physical exam, and doing some basic laboratory work. So in the physical exam, I'm actually looking at the vagina and the discharge. So what's typical of a yeast infection are the vaginal lips are really red and irritated, and then there's discharge even on the outside or in the vaginal canal, which typically is white and curdy, but can also be very thin to very thick in consistency. So I take a swab of the discharge and I do a pH, because there's a lot of other vaginal infections besides yeast, and most of them are associated with a higher pH in the vagina. So I'm looking for a normal pH, which tends to be around 4 or 4.5 in the vagina. And then I take a look at that discharge underneath the microscope, and I'm actually looking for yeast. And if I spot it, then it's clearly a yeast infection, and I'll go ahead and treat it. If my patient is getting more than 4 yeast infections in a year, I'm going to do blood work because I want to look at blood sugar levels and their immune system. I have a 2-prong approach to treating yeast infections. The first is to get rid of symptoms and decrease the amount of yeast in the vagina, and the second is to make sure the yeast infection does not come back. I do this by first addressing diet, and a diet should be whole foods and be very limited in the amount of sugar, processed foods, and alcohol. The sugar, processed foods, alcohol, they all go into feeding yeast, and what we want to do is to get rid of the yeast, not feed them and have them populate. I always recommend that during a yeast infection, women avoid wearing pantyhose, non-cotton underwear, and really tight clothing. I also recommend overall immune support, so supplements such as garlic, vitamin C, and zinc can be very helpful. I always recommend a probiotic such as Lactobacillus acidophilus, both orally and vaginally. And I might also recommend vaginal suppositories to get a really local antifungal, anti-inflammatory treatments. These suppositories might include thuya, Oregon grape, tea tree oil, or boric acid. When patients follow my protocol, my success rate for treating yeast infections is pretty high. Not only are symptoms gone within usually 3 days, but the yeast infections just don't come back. If someone wants to reverse their yeast infection, I recommend adopting a natural living lifestyle. This includes a diet that eliminates sugar, processed foods, and alcohol, and includes a lot of whole foods, organic, nutrient-rich foods. I also recommend taking a probiotic supplement to help repopulate the vaginal flora and prevent against the recurrence of candida. And I also strongly encourage visiting a naturopathic doctor.